As we age, we begin to feel our bodies ache. We notice how our knees hurt more frequently. We notice how our lower back strains when performing tasks that never bothered us before. As we experience senescence, these types of pains and strains are normal. Our bodies are not built to resist the wear and tears of aging, albeit some will experience aging better than others. However, those that experience normal wear and tear more frequently, more painfully, and with other comorbidities have a stronger likelihood of experiencing life differently due to the changes that are needed to accommodate their diseases. Chronic diseases, age-related or not, are persistent diseases that are experienced for extended periods of time which hinder a person's ability to function normally. For example, osteoarthritis, commonly referred to as an age-related disease, is a disease that affects the synovial joints within the body. Osteoarthritis is known to cause pain, which can worsen in severity as the disease progresses, leading to lengthened periods of sedentary behaviors, which can interact negatively with other chronic diseases, such as cardiovascular disease or diabetes, both of which are non-age-related chronic diseases that also hinder an individual's ability to function normally. Experiencing chronic disease, especially those that cause pain and decreased mobilities, are shown to be correlated with an increase in lower quality of lived experiences because of the physical changes individuals need to make. Studies also demonstrated that individuals with multiple comorbidities experienced an even poorer quality of life in comparison to individuals with fewer chronic diseases. Though studies show this correlation between chronic diseases and lower quality of life, specifying which chronic diseases has the greatest impacts overall is lacking. Yet having the understanding that this correlation exists, researchers began to inquire about the effects that chronic diseases have on a person's mental health. Studies speculated that those who live with chronic diseases will experience increased mental disorders such as anxiety, depression, and stress, which themselves can have negative physical impacts on the body. Interestingly, through questionnaires, studies demonstrated that there was no correlation between increased mental health and chronic diseases independently, that other contributions such as social, material, and relationship factors were more likely the causes for increases in mental health problems. Mental stability, as it independently relates to chronic diseases, even as individuals age, remains minimally to not affected at all. It is speculated that experiencing minimal to no mental health related to chronic diseases themselves is relational to how people live culturally and how they follow their cultural patterns of health and well-being.